Hello, this is Dr. Lewerenz at Longevity Health Institute. Hope this is finding you well in 2019. One of our first days back in the office. Listen, I get asked this a lot, especially in our new concierge patient care VIP, if you will, program, is what do we do? What's unique about Longevity Health Institute, and what is personalized medicine, or what is functional personalized medicine? Well, what's very, very key here is what is personalized medicine. It is what you deserve in every office, in every clinic, in every visit, in every setting. This is the situation though. We are in an industry in healthcare where things are being conglomerated in mergers. The statistics and studies are out there. This is not good for you, the patient, the consumer, and that is where hospitals are buying up clinics, hospitals are buying up and merging with other hospitals, and you're becoming a number, a statistic, and everything is approached with a cookbook approach instead of a individualized, personalized approach. So what we do here in our medical setting at Longevity Health Institute, myself and my other practitioners, is that we approach every individual, every visit in a very intimate, personalized way. And let me give you some examples of that. Is we take a physiologic approach to every visit, and that's teasing apart some systems that are very key in your overall health, which includes lifestyle and diet and hormones and stress and sleep and how you detoxify and genetics. And we discuss often all these, and we discuss what our overall plan is, and we reassess your concerns, your goals, but also our goals to keep you well and keep you out of hospitals and out of illness, essentially. But let me give you a couple examples of today, January 7th, 2019, about what would be personalized medicine. One of my patients this morning, actually, interestingly, is a very unique patient. She has autoimmune disease of her liver. It's not new. She came to me with this. And she struggles with chronic liver stress, liver fibrosis. She has to be very careful about what she takes, what she consumes, medication, supplements, etc. And she has this autoimmune disease of her liver that's causing liver damage, puts her actually at liver risk for cirrhosis and ultimately even a liver transplant, and about a 10 to 15% increase in liver cancer. She's young, she's in her mid-40s, so this is very significant, very serious. She also has Crohn's disease, another autoimmune inflammatory bowel condition, and she suffers from that. The last few years with us, she's been very stable with that. We've got her off some of her medications, off steroids. We're doing a functional approach to her diet and supplements and lifestyle things that are really helping the inflammation and restore and get a regenerative cellular approach to her colon and her gut. She's off some foods that are causing inflammation in that, and she's doing very, very, very well in that sense. So she had a scope. She gets scoped by her gastroenterologist every year. She had a colonoscopy, and he saw one erosion that is new. Mind you, she's off all medications, doing very well, off steroids, which have a lot of side effects. But he was concerned and talked to her about medication she should be on, and potentially a steroid. And so she came in and discussed with myself what would be, what's the best approach. And this is where we talk about personalized approaches. We talk about one size doesn't fit all. Her gastroenterologist, which is doing a wonderful job with her, was kind of leaning towards maybe she should do a 3-month burst steroid dose. Her concern is when she's been on steroids before, it caused adrenal issues, weight gain, mood issues, hot flashes, a lot of side effects to steroids, of course. I'm reluctant for her to do something like that, and I encouraged her to probably slow down and first sometimes do nothing. She had one erosion, no symptoms, feels wonderful. This was just on her scope. So sometimes the best personalized approach is nothing. Just look at the statistics, look at the patient, treat them individually, and listen to their concerns and needs. The other thing is, though, I researched the medication for her that was another potential medicine use for her Crohn's, and there's a lot of liver issues. In fact, one of the biggest concerns and warnings and precautions is the side effect of working through the liver and liver enzymes, and would stress eventually her liver. So long term, that's not a good choice. I think what we're going to lean to right now is doing nothing managing her and seeing, maybe check some inflammatory and immune numbers in her blood. She's, again, symptom-free, doing wonderful, especially compared to 3-4 years ago as she came to us. And we may use an off-label medication that's called low-dose naltrexone, which can balance the immune system. But the point here is we took our time, we looked at her individually, we treat her personally, and not a one-size-fits-all cookbook, quick bedside approach. So that's one example. And the other example is another very significant, serious patient I saw here today. She's been a patient of mine for a few years. She has stage 2B breast cancer. She has a large concern about the effects of the medication that she is taking that are essentially an estrogen blocker. So estrogen is a big feeder to some breast cancers. She has an estrogen receptor positive breast cancer. So typically the first 5 to 10 years, a conventional oncologic good approach is to block estrogen. You're not feeding the cancer, and I would also agree. The problem is when you don't look at a person individually and look at them from head to toe as a whole, this patient, I should tell you, is 78, is what are the risk, rewards, what are the benefits, etc. of this medication. Since she started this tamoxifen, this estrogen blocking medication, she has had hot flashes, can't sleep, major anxiety, big brain fog, even down to some cognitive big issues. Her husband joined me today in the visit, and this is creating a lot of global life, quality of life issues for her. So we have to talk and consider these things in her overall health. She sees me for some integrative, functional, nutritional diet, immune boosting approaches that complement her traditional approach to her cancer, which I feel is always going to be the best. But the important thing with her is we took our time and discussed options. I did a little research on the tamoxifen benefit with stage 2B breast cancer like hers, estrogen receptor positive, and her risk rewards are about 14%, in 5-year survival of taking tamoxifen for her. So we didn't make any decision today. We're going to sit and think and talk, and I'll probably talk to our oncologist on that. But you can see that here the risk reward benefit may not be favoring her, meaning she's at an osteoporosis risk. She's already experienced some dementia and cognitive loss due to estrogen loss. You need estrogen for a female's brain with aging. She has major anxiety, mood, depression, can't sleep. So I hate to layer on her other medications and cause potentially more problems when we may be able to mitigate some of these side effects in a individualized way and making the proper choice for her and not just a one-size-fits-all and giving her this potential 14% reduction in reoccurrence of breast cancer. Again, almost at age 80. So we have to think about where she's at 85, 90, quality of life, dementia, lifestyle issues. So that's personalized medicine. That's treating the individual. Now I can tell you about some other cases today just off the top of my head. Somebody that we discovered here has hemochromatosis, high iron levels, polycythemia. This is higher blood thickening levels. And he never knew. He's actually a young man, mid-20s. This puts him at risk for blood clots. His father, interestingly, died of hemochromatosis, liver cirrhosis, never drank, but high iron levels can damage your liver. So we screened him for this, even though he came in very well and healthy, just here for prevention. But he had unknown, unsuspected hemochromatosis, high iron, which can be very damaging to your liver and cause cardiovascular and vascular and clot risks. So that's a personalized approach. May seem like, well, that happens everywhere. Well, I think the difference is this. Our visits are way beyond the national average of internal medicine and family practice visits, which is 7 minutes. Most of our patients where even routine visits are 15, 20, sometimes 30 minutes. New patients get an hour or more. So you can see the difference when you get personalized approaches, functional approaches. You get to root causes, you solve things, you improve life, quality of life gets better, and wellness is achieved. So consider these things. Hopefully, this educates you about personalized functional medicine, what we do here at Longevity Health Institute. 2 locations. Share this, please, with others. Find us on the web, longevityhealthinstituteinc.com. Follow my YouTube channel. Like us on Facebook. The reason is you're supporting a clinic here that is against the grain of a merger, the mass treatment, the volume production line, and we're here to help you, and we're passionate about that. So this is to you in 2019 to be well, and for us to forward be pursuing health and wellness for our patients. This is Dr. Lewerenz. Take care. Be well.